Australian National University. Today's not a standard seminar. I'm very excited that we're doing a launch today of a new report that's been put together by the ANU Menzies Centre for Health Governance, and the report's title is Australian COVID-19 Policy Responses, a Health Equity Report Card. My name is Jensen Sass, and I'm a research fellow at RegNet and also the convener of this of the seminar series here. And before we begin, I'd like to first acknowledge the traditional owners of the unceded lands on which we're meeting today and pay my respects to elders past, present and emerging. And I'd like to extend that respect to Aboriginal and Torres Strait Islander people who are on this call today. Before I introduce the speaker, just a few small housekeeping items. So firstly, we're in meeting mode today. But if you have questions, please use the chat function during the seminar itself, and then you can raise your hand and ask questions verbally afterwards. You should also know that today's session will be recorded, so that means that your name will be visible to people who watch the recording afterwards, and if you speak, that will be accessible. Lastly, if you're on social media, feel free to tweet live. Our handle is @ANU RegNet. And our first speaker requires very little introduction in this context. Professor Sharon Friel is an ARC Laureate Fellow. She's a Professor of Health Equity and Director of the ANU Menzies Centre for Health Governance at RegNet. She's also a Fellow of the Australian Academy of Social Sciences and Co-Director of the NHMRC Centre for Research Excellence in the Social Determinants of Health Equity. Her 2019 book, Climate Change and the People's Health, highlights the importance of addressing the consumptogenic system. Sharon will serve as a speaker, discussant and chair today, all in one. She's going to go first, so I'm going to hand over to you now, Sharon, and you can introduce Edwina MacDonald, who's our other speaker. Thanks everyone for joining us, and thanks, Sharon.
Lovely, thanks Jensen, and I'll begin by acknowledging the first Australians on whose land we're meeting. I'm on Ngunnawal and Ngambri lands, and pay my respects to elders past, present and emerging. So really delighted that you're all joining us today from across the country, and where the purpose of this session is to launch our new report from the Menzies Centre, which, well, I'm going to tell you much more about it in a second, so I'll not say any more about that. And really delighted to be joined by Edwina MacDonald. Edwina will be known to many of you, I'm sure. She's the Deputy Chief Executive Officer for ACOSS and Director of the Policy and Advocacy work. And Edwina and colleagues have been doing incredible work through ACOSS around many of the issues that we're going to speak about today. She's a lawyer by training, a very strong track record in social justice, human rights, all of the sorts of issues that are, of course, so fundamental when we think about social and health inequities and trying to galvanise action to address them. So I'm going to take a little bit of time to tell you about the report, and then I'll hand over to Edwina, who will also speak about some of the issues and hopefully give us an uplifting call to action at the end when we hear about a lot of the work that ACOSS have been doing in these different areas. So with no further ado, and then we'll have plenty of time for discussion. It's lovely that we're in meeting mode so we can see people and we can be much more interactive. So please do chat away in the chat function, and then we'll get a chance at the end to discuss. So let me do this technical thing where I have to share a screen. And so let me do this. Screen. Give me 1 wee second. So I'm hoping you can see this is in full screen mode, I'm hoping. So this is thanks Julia, this is the front of the report, and so the COVID-19 policy responses, a health equity report card. Before we sort of speak about the policy areas that we focused on in this, I do just want to remind us or make us think about this sorts of areas in life that affect our health, that affect our ability to live with dignity, a sense of well-being, and to prevent poor health. To do all of that, we need material resource, we need a sense of control over our lives, and we need a voice in the decision-making processes of the whole variety of things that affect our life. These three things are shaped by action that sits way outside of the health sector. And so everything that I'm going to speak about today is beyond the health sector. It's actions in these other areas that matter. Well, the health sector, of course, is vitally important. I'm just talking about other areas. So I'm going to talk about the social determinants of health and health inequities, which are very unequally distributed. Those social determinants, material resource, a sense of control over our life, and voice in the decision-making processes are incredibly unequally distributed, and that flows through to the inequities in the health outcomes that we see. So, of course, we've all been living through the pandemic. We've seen a whole load of different policy responses take place across the country at the federal and state and territory level. Last year we did a report that looked at all of the different, the suite of policy responses. This year we wanted to focus on three areas: employment, income support and housing. Three very important social determinants of health inequities. We looked at all of the policy measures that were put in place at the federal and state and territory level between the 12th of March last year through to the 1st of October this year. And there were 145 policy measures put in place across these three different domains. One of the things that we did was map these policy responses across the lockdowns, because of course that really mattered. Our lives were being disrupted associated with the lockdowns. This is an image, I'm not going to speak through it, but this is an image at the federal level. We did this at federal and each of the states and territories. If you want to see what's happening in all of the jurisdictions, please look at the report. I'll put the link to the report in the chat when I stop talking. But really what you see on the slide is along the bottom the lockdown events that were happening across the various jurisdictions, and then the federal responses that took place in employment, income support and housing. Then what we did was we graded them. Each of the different 145 policy measures, we graded them, the health equity grading system, where we scored each of their functions either positively, neutral or negatively. If it was neutral, really what the policy measure was doing was just keeping the status quo. Yeah, it wasn't making things better or making things worse, it was creating the status quo. But remember that the status quo is we have incredible inequities in employment, social income and housing, and we've got incredible inequities in health outcomes. So the status quo is not a good thing. And what we wanted to see was, were the policy measures going to do something about the structural drivers? So if it was going to improve the structural drivers that redistributed power, money and resources in a long-term basis, it got an A. If it was addressing sort of conditions of daily living conditions, it got a B. If it was positive for health equity, and it went the other way, if it was negative for health equity, and if it was really bad, it got an F. And we'll come to the F in a second. So what did it look like? This is the health equity report card for COVID-19 policy responses across employment, income and housing. And I have to acknowledge Erin Walsh from the Research School of Population Health, who created this for us. I think she did a marvellous job. You can see it's variable across the country. You can see the top line scores that are grades that were given to the feds and each of the states and territories. If you've seen the media today, the headline news was the F for housing from the federal government. So let me take us through this in a little bit more detail, because of course it's highly variable. There were some good things and there weren't some good things, and my takeaway message is we've got to do much better, or else going forward we're going to see very significant health inequities. But as I say, it was variable, so I just want to speak in each of the policy domains in a little bit more detail. So this is looking at the actual policy functions themselves, and how we got to the overarching score at the bottom of, you can see for each of the jurisdictions for employment, they each got a C. Remember, the status quo. But there were some positive things that happened. You can see the enhanced labour protections. That's important. That's an important structural change that has very positive implications for health equity. Remember, a sense of control over our lives, a sense of material, ensuring material security, that could make a big difference. There's some more kind of the C's, the general C's in the middle there, the sort of the yellowish colour, and these were the more sort of short-term, very important fixes, as it were, to keep companies' places of employment open. That's important, of course. And then down at the bottom, where there's another not a good score at all, was the reduction of labour protections for people. And that, of course, makes people incredibly vulnerable. Not only are they having material insecurity, financial insecurity, but the pulling back of labour protections by the feds. So who benefited or who lost out of all of this? So JobKeeper, of course, was a very, very important policy intervention. But there were people who did not fare well out of that. You can see them listed here: the migrant workers, gig economy, the million casual workers were ineligible for these supports. I have to mention the universities, the public universities, where we weren't eligible for this. And of course, really importantly, JobKeeper wasn't extended. So creating a sense of vulnerability. But what we did see happen was, people speak about, well, there's been a rebound. Some of the employment figures have bounced back. Well, they have, but into casual, part-time, insecure work. Now, some of that type of working, of course, is very appealing to a number of people, but when you don't have options and when that's what's readily available, we know that these are the types of employment situations which are incredibly precarious, which don't have the basic protections like sick leave, etc. And all of that matters. Well, you might be saying, well, why on earth are you talking about this, Sharon? What on earth has this got to do with health? These data are a bit old, but even back then, before the situation was as bad as it is now, back then, in the figure to do with depression, the highest bar is 3 adverse working conditions, so very precarious employment, and that's worse for your mental well-being compared to having no job at all. So the takeaway is the quality of employment matters. It's not just getting people back into jobs after COVID. There's an opportunity to think about the quality of employment because it also matters for health. What about income support? Again, that was very variable. And of course, Job Seeker was a very big intervention. Here you can see how it varied. One of the things that we scored the federals, this was a D score, was about the access to personal capital, and I'm going to speak about that in a little second. But you can see there were some positive things that did happen across the states and territories, but these have been relatively small scale. What we did see was a decrease. So when Job Seeker was in, or the Job Seeker Supplement was introduced, there was a reduction in poverty. Edwina, I'm sure, is going to tell us about the lived experience, that the sort of the positive effects of that. But well, what I'll show you in a second is when that stopped, it takes us right back into that incredibly risky situation or harmful situation for a number of people. I think what I take away from that is if government wants to act, it can, and just think, the idea of providing material security, providing a sense of control and dignity over people's lives. But people on income support, almost all of the people on income support missed out on the disaster payment that was introduced once that once JobKeeper stopped. And one of the big structural things that we thought was rather concerning was access to super. Now, of course, there's only certain groups in society that have this possibility. But in a survey from the Australian Institute for Family Studies looking at popular families across Australia, where 3/4 of people were accessing their super early. Now that creates a long-term vulnerable situation for low-income households, and also the other groups that were required to do this, or that did this, were young people. So we've got this situation of depleted superannuation stores for those groups going forward. And of course, income is highly correlated with health. This was some analysis that ACOSS and colleagues at the University of New South Wales did. This was before COVID-19 and all of the responses were put in place, but it just shows you this incredible social gradient where the better off, financially off in society, do much better in terms of self-assessed health, and there's a strong correlation between self-assessed health and a whole load of other chronic health conditions. So it matters, material security matters. And then finally, housing. So the Fed's got the F because of this little intervention that took place, which was really the home builders grant. People who could already own a home, who could already afford to renovate their home, had access to this grant. Where we saw most, and what that means is a widening in the structural inequities within society. It's just an intervention that widens those inequities, so we gave it an F. But what you can see, I want you to take away from the picture of housing, is that there were positive interventions taking place, particularly at the state and territory level. Look at the ACT, Queensland, Tasmania, Victoria and Western Australia in terms of investment in social and public housing infrastructure. And again, Edwina will remind us the importance of public housing investment, social housing investment. Access to quality, affordable housing is, one, it's a basic human right, and it's also very important for our physical and mental well-being. And this is really just a reminder of what was happening to people throughout COVID. So even whilst those interventions were taking place, this is the analysis that's done every year by Anglicare Australia, looking at the rental affordability. The rental sector, housing rental sector, has been the fastest growing sector in Australia, really over the past couple of decades. So thinking about rental, private and public rental housing is a really important policy issue. They surveyed, you can see, almost 75,000, or identified the 75,000 rental listings on the books, and looked at how affordable they were based on the weekly income of different household types. I just think that's shocking. These are predominantly low-income households, and a tiny fraction of them were able to afford, based on these income support measures, a tiny, tiny fraction were able to afford what was out there in the private rental market. So when you sit that alongside a lack of public social housing investment across the country for the past number of years, we've no wonder we have the housing crisis that we have. And that also really matters for our health. This is some analysis by colleagues here in Australia looking at the affordability crisis, basically housing affordability crisis in cities, again before COVID struck. And what you can see, really, the takeaway from this visual is the cumulative impact on mental health, the mental health score of people with increasing housing affordability, stress. Mental health gets worse, and it gets worse over time. So unless we think about our housing crisis in Australia and we think about the inequities associated with that, I think we're going to see an increasing associated health inequities crisis with this. So what were our takeaway messages? Look, there were positive things that did happen. I cannot deny that at all, and I think that should be applauded across the states and territories, but we have to absolutely do better. The majority of the responses for employment, income support and housing maintain the status quo. We're seeing a dominant C in all of this. And if they maintain the status quo, as I said at the beginning, that's all about inequities in employment, income and housing. And we've already got the associated inequities in health, physical and mental health outcomes. What it means these status quo type policies are doing is just entrenching these existing inequities in these policy conditions that we've had in Australia over decades. There were absolute silences in the policy responses, really nothing to address these underlying structural issues, issues of precarious employment, issues of decent income levels, and issues of the housing crisis. And I know we didn't look at there were no climate change measures, but if we're going to do something about health inequities in Australia, we've got to make sure we address the inequities in climate change adaptation. So the sorts of adaptation policies that are put in place are really planning policies, housing policies. So we've got to address those, and we've also got to mitigate, because it's the most disadvantaged groups in Australia who will be impacted most. But there was absolute silence. So going forward, a key message that we make in the report is the need for a social vaccine. This was some work that Fran Baum had started a number of years ago, and we wrote a little bit more about it earlier this year. So a social vaccine that really tackles the sorts of issues that I've been speaking about, that attacks the structural drivers of social and health inequities, and that addresses the social grading. I've spent a lot of time speaking about the socioeconomic disadvantage within these analyses. I don't have time to speak about all of the inequities that we will see as a consequence of these policy responses, but it will affect Indigenous Australians more than non-Indigenous Australians. We'll see the exacerbation by the spatial inequities, and we'll see the exacerbation, and we've already seen this happen for people with disabilities. So there's a whole load of ways that a social vaccine could actually make sure that we address these intersectionalities of inequity. So what are we asking from the report? What do we want to see going forward? Based on this analysis, what do we want? We would love to see a national health equity strategy that connects to the existing strategies that are out there, that connects to the call for a climate and health strategy, for example, from the Climate and Health Alliance. But we need a national health equity strategy. We need a national employment strategy. Imagine if we had a strategy that was called Decent Work for All, that's supported by a just transitions framework. Imagine if we had a green economy, so coming out from the COP deliberations, a transition to a green economy, but that has to be a just transition. We need a social policy, again called Supporting Australians in Need, that is actually based on income support levels that are calculated to ensure people can live a decent, a flourishing, a hopeful life. And we do need to stop the tax relief for the housing investors. I know that that's an incredibly politically controversial issue, but that creates these structural inequities within our society. And wouldn't it be fantastic, building on some of the social public housing infrastructure investment that we've seen across states and territories, that we do have a green social housing economic stimulus package. I would love to see these four things in an election promise going forward. And there is an important moment, this is my last slide, an important moment where we've seen health absolutely elevated up there in our deliberations about the economy. Let's keep that going forward. Let's use that window of opportunity. We can't think about health in a biomedical way. We've got to be thinking, well, we need that as well, of course, but we also need to recognise these social dimensions of health and the possibilities of good sectoral policy and the co-benefits from that. And so what that provides, with health being right up there in the public and political discourse, the opportunity for a well-being and a green economy. We've already got a well-being framework here in the ACT. Can we think about doing that across the country? And I know it's always very glib to be able to talk about progressive and inclusive governance, but we do need courageous government to step up. We've seen it can happen. Some of these policy actions are to be commended. If you want to do it, you can do it. And to make sure that governments continue to do some of those good things, let's have really noisy and very engaged civil society. So I want to thank the co-authors of the report who are listed here: Shannon Price, Ashley Schramm, Belinda Townsend, Sharon Goldman and Fran Baum. Thank you for listening to me. I hope we'll generate some discussion, but delighted to hand over now to Edwina.
Great, thank you, Sharon. Sorry, just working out where my screen has gone now. All right, I've got it all sorted now, I think. Thank you, Sharon. Thanks for that presentation of the report. I'm delighted to be able to speak at the launch of the report. It so clearly lays out the structural causes of health inequity and the actions that must be taken to reduce inequities in power, money and resources to tackle health inequity. And thank you, Sharon, and to your co-authors for your ongoing work in this area. I would like to start out by acknowledging also that I'm coming here from unceded Aboriginal lands. I'm on the lands of the Gadigal people of the Eora Nation, and that sovereignty was never ceded. In this report, you talk about the disempowerment through lack of voice, control and denial of self-determination as a major psychosocial route to poor health. And we continue to see the harms of this playing out. Just today, we've seen the disturbing news about the COVID outbreak here in New South Wales in Moree, nearly entirely impacting Aboriginal communities. And before Parliament, we've got a bill that will create barriers to voting with a disproportionate impact on First Nations people. First Nations people have the solutions and their voices must be at the centre of policy design and implementation. And I echo the calls that you make in the report about the need for us to embrace the Uluru Statement and to support the campaign for First Nations people to have a constitutionally recognised voice to Parliament. In talking today, Sharon has asked me to take you through some of what ACOSS is seeing around the structural causes of health inequity and what we're doing to address this. In doing so, I'll focus on federal government action and inaction. I know the report also looks across state and territory actions and inaction, and I can see from the participant list that I've got some COS colleagues here from states and territory COSs, and no doubt they'll have some comments on what's happening at the state and territory level. As is evident from the report card and from Sharon's presentation, the status quo in Australia is appalling when it comes to poverty. Poverty remains a persistent experience across Australia, with about 3 million people affected. Over the past 2 decades, we've seen sustained economic growth, the COVID recession aside, yet we've also seen a widening of inequality. The incomes of middle Australia have grown at a much higher rate than the people who need to rely on social security, especially people in unemployment, single parents, and people with disability. Over the 2 decades, we've seen the median household incomes rise by 45% in real terms, in comparison to people unemployed at 12% and single parents at just 7.9%. And at the same time, those with housing and wealth have shot ahead, with COVID accelerating these income and wealth inequalities. For a moment last year, and we saw this as green on your report card, we saw the power of tackling the social determinants of health. With increased job seeker and job keeper, people were also housed and evictions banned. And as Sharon said, overnight, the government almost abolished poverty for people receiving job seeker. I should acknowledge here there were people left behind, as Sharon noted, particularly people on temporary visas, migrant workers who had no access to income. The indicators of what happened last year was that there were substantial health benefits flowing from the changes, including a drop in suicides. And this has certainly come across loud and clear from the people that we work with at ACOSS as we advocate for change. As part of our approach to advocacy, it's really important to us to have people at the centre of our advocacy, informing our policy, and also amplifying and enabling their voices in advocacy. And when we talk to the people we're working with, so much of what they've talked to us about, what they bring to us around the impacts of the increase to job seeker and the subsequent removal of that is health related. And I just wanted to take a moment to share with you some of the stories that we've heard. I'm going to share the screen. Here we go. So I'll read these out as I'm conscious some of you may be on small screens or possibly eating your lunch while you listen along. These stories here are from the 550 Reasons to Smile campaign, which is an initiative jointly from the National Council of Single Mothers and Their Children. And what we can see here are stories of what it was like for people when they received that supplement to job seeker. So from Maureen and Grant, we could afford a new phone. Still in lockdown, the picture was taken near our flat and during my allowed exercise. We take pictures to mark the beauty of life. I know it's extra hard for us in Victoria, but we had felt isolated, scared and alone for several years. We are now warm. We have new glasses, haircuts and all prescriptions filled. Our mental health has never been better. We would skip meals before the grandchildren would visit to afford those treats. We can't see them now, but our cupboards are full of their favourites. We are both in our early 60s and our best skill was hiding our poverty. After our small business, our life went bankrupt. We read the posts and comments from this page. It's so kind. And then we have this message from A. An old gas heater died, and thankfully to the $550 supplement, I was able to go and purchase a new one straight away to keep my new baby and 2 other children warm at night. One has severe croup. I normally would not have had the money. Very thankful. So as you can see, the stories that came through this campaign, also through the other work we were doing, just demonstrate the really tangible impact that the increased income support had on people's health. But as you also know, it's not the end of the story. When the supplement was removed, the stories flooded in as to how this was impacting people, their ability to afford the basics and the care for their health. Things that they'd seen during this brief period, what was possible, now removed. So if we look at these stories, we've got a story from Lisa. When we received COVID support, I spent what I was given on mental health support. When it was stopped, I could no longer afford it and had to discontinue it. Now it's a struggle once again. I had to go with, and Ashley Stevenson has told us, I had to go without at least 7 meals in order to afford a haircut. Seeing a medical specialist is now out of the question, let alone a dentist. I had a couple of friends who provided me with some food so I could pay my rent. Right now, the reality of what we're seeing is that we're back to job seeker at $45 a day. Rent assistance is frozen. There's no large scale investment in social housing. And we've seen $16 billion of tax breaks going to people already with jobs and mostly going to men. So wealth is just growing for the people who already have it. And the last 18 months has shown us that as a wealthy nation, tackling the social determinants of health is entirely within our reach. Yet, shamefully, we've missed that, well, the government didn't use that opportunity it had to implement some long-going positive change in these areas. Stop the share now, there we go. So we need to continue to work on the big policy levers that will change this. For ACOSS, our core agenda is to lift social security and invest in social housing, alongside a commitment to full employment and a jobs and training guarantee. We need to push back against harsh and unrealistic payment requirements and promote a system that gives people agency and control. And as your report shows, these are key to addressing health inequities. And we need to do this with a shared voice and a strong focus. The past 12 months or 18 months has also shown us the power of collaborative advocacy and participation by people directly affected. On income support and on housing, the Raise the Rate and the Everybody's Home campaigns have both worked to increase the visibility of people directly affected and to increase their input into campaign and political advocacy. With the Raise the Rate campaign, we've trained 50 people who've spoken in the media about income support. They've been involved in parliamentary hearings and campaign events. We've had 500 people who've been supported to make individual submissions to inquiries. We've also worked collaboratively and in coalition as a sector and across sectors with broad-based support for these campaigns. And while we've not achieved the campaign goals as at this point, we have shown that it works. Job seekers not enough, but this approach did deliver the first real increase to unemployment payments in almost 30 years. At less than a $4 a day increase, it's nowhere near enough, but it secured putting $3 billion back into the social security budget. And we've seen significant state and territory announcements on social housing, and the pressure on housing continues. Over the past 18 months with COVID, we've also seen what happens when disasters hit. And it came as no surprise that people with the lowest incomes, with insecure housing and insecure work, people experiencing other forms of inequity, with a lack of power, money and resources, were hit hardest and first by the pandemic. The impacts of COVID are a perfect example of what it looks like when you have deep inequalities. And we're also dealing with another crisis in climate change. And the situation here is no different. We know that the people with the least are being hit first and hardest. Climate change is increasing extreme weather events like bushfires, droughts, floods, storms, heat waves. This threatens people's homes, their livelihoods, their health, quality of life, employment, and it increases the risks and burdens for future generations. People experiencing financial or social disadvantage are at most risk because they have fewer resources and less power to cope, adapt and recover. And that's why ACOSS is also campaigning for a fair, fast and inclusive climate change action, for a safe, more inclusive, equitable and sustainable future. As we head into the federal election period, we're working to focus the debate and the policies on the big levers to change the picture: income, employment, housing, and to tackle climate change. We're also backing in First Nations voices to change the record in the criminal justice system and for a constitutional voice to Parliament, as set out in the Uluru Statement. And we'll continue to do this work by building a sound evidence base, by putting people at the centre, supporting participation of those directly affected, enabling and amplifying their voices, and by mobilising in a broad-based way, working collaboratively as a sector and also across sectors. We all need to be getting out of our silos. And yes, you can count on us to continue to be brave and persistent with our advocacy. We will be noisy and engaged, Sharon. Such value in reports like this one that clearly set out the evidence of the harm that current policies are causing and make clear calls for the changes needed to reverse it. A shared understanding of the impacts these policies and others have on health is crucial. Improving health for all is not only about investing in our health system, it's also about income support, housing, employment, and community services. And as one of the wealthiest countries in the world, it is inexcusable that we have not tackled preventable health inequalities. So I will finish, as Sharon promised, by urging you to have a voice in the election context, and also with reforms like those that we currently have before Parliament, requiring voter ID, or the bill that will increase the waiting period for migrants before they can receive income support. We all need to make sure that decision makers and candidates are hearing the preventable harm to health that is being caused by a wide range of policies. And it would be remiss of me not to add, sign up to the campaigns. There's the Raise the Rate campaign, the Everybody's Home campaign, Fair Fast Climate Action for those of you in the community sector, the Uluru Statement, and Change the Record. I'll in a moment add some links to the chat for you. Thanks for the opportunity to speak today, Sharon, and thank you again for this report.
Brilliant, thank you, Edwina, and yeah, that lovely sort of call to action at the end. Yeah, I think just so important to have an organisation like ACOSS and all of the COSSes, and I know the others on the call, the importance of a collective voice moving forward just can't be emphasised enough, and very a very strong and such a great use of evidence in these campaigns. So really, it would be lovely just to engage now with people who are on the webinar. Either sort of take yourself off mute, stick something in the chat. I don't see anything yet in the chat. If you've got a question, raise a hand. I don't know if we can go into the mode that we can see everybody in the meeting. I don't know how to do that. But yeah, over to the audience now. Be just great. Jensen, I see your hand up.
Yeah, look, thanks Sharon and Edwina. A lot of points of discussion here potentially. I mean, I just had a question, Sharon, about the way that you did the grading of different policies, and I actually dropped out for a moment there, so my apologies if I'm just recapping something here. But in terms of the effects that different policies have, the way they're assessed in terms of their effect on equity, I was wondering whether the policy is assessed for the equity impacts on the particular group that the policy targets, or whether that's an evaluation of the aggregate effect of the policy. Does that make sense?
Yeah, it's an aggregate effect. You know, if it's a targeted policy, then it's, you know, by implications it's on that particular group, but it's just a more general assessment that we did. I should say none of it was particularly sophisticated. We literally looked at each policy for what we thought was its ability to address the structural factors or the more intermediary, daily, everyday sort of conditions, and made a call on it. So it was very qualitative in the assessment. Yeah.
Great, thanks.
Anthea, I can see your hand. I can't see everybody because we're on this.
Sure. Okay, thank you. Thank you for that report. So really interesting work, and I want to pick up on something that both of you said, but Edwina, you probably said it the most clearly, which was the sort of need to get out of our silos, and I know this is something that really underlies a lot of Sharon's work. And one of the things I'm really interested in about from COVID is what happened in the government processes that changed, because from my understanding of working with some of the people who worked on some of the decisions like how to shut down the economy or how to roll out some of the different programs, was that they saw two really distinct shifts that happened in that process of policy formulation. The first was they saw it, one where it really was clearly not just a health issue or just an economics issue. And so instead of it going primarily to one of the departments, it was one of the times they really did see multiple departments come together and hash things out around the table. But they also said on some of the things like the JobKeeper, JobSeeker stuff, that they also at a very, very early stage spoke a lot more to industry and to businesses, and in terms of actually working out how to formulate their policy rather than working it out first and then trying to roll it out. Now, none of this helps the point that Sharon and you make, Edwina, about some voices not being sufficiently at the table. So I totally take that. But I'm also really interested in like, have you seen any work about these more integrative approaches, both across government, but also government to non-government, and whether there are sort of structural forces that kind of worked relatively well in that particular circumstance that could be rolled out sort of institutionally in other circumstances?
Edwina, do you want to go first? And I've got a few comments, but I'll let you go first.
Sure. I mean, there's kind of two parts to that. There's the engagement, I guess, with civil society or non-government, and then there's the actual approach to the policy making. And I think at the outset of the pandemic, in terms of policy making, we did see a much more, I guess, the policy changes we were seeing, the supplement, were adventurous, unexpected. It wasn't. I wasn't at ACOSS at the time. I had been at ACOSS, left to come back. But it was a welcome surprise when that announcement came through, having advocated across that for so long, and to sort of see that coming together of economic support that will also further fairer society in supporting people with the least was such a positive experience. And I think coupled with that, what we saw earlier in the pandemic response was a real sense of collaboration across different governments and state and territory governments and departmental response. I think we've seen that drop off fairly quickly, and certainly the opportunities that were lost in having measures that would both progress the economy and the economic aims, as well as the fair and inclusive society. There were some really concrete, broad-based, widely backed proposals around social housing, around investment in green housing, sustainable housing as well, that just weren't taken up. And that was really disappointing. I think also investment in the care sector was another opportunity when you actually look at a cost per job analysis of how much investment in different industries creates jobs. In the care sector, you can create a lot of jobs with very small investment. In part, that's due to the inequity in pay in the care sector, which is not something that we would want to see continue. But there are some real lost opportunities there. In terms of engagement with government, I think from ACOSS's perspective, we didn't see a shift of increased engagement or collaboration. I think from the outset, we've been there knocking on the door, highlighting the importance of a community-based approach in responding to natural disasters. We did some work, particularly with ACON, looking at the experience from the HIV pandemic and what we learnt from there, and the importance of community-based responses, of community-led responses and community resource responses. And I think what we're seeing now in terms of the vaccination rollout is, it's like it's one of those examples where you really wish that you weren't right, but you can see that having not invested in the community collaboration and engagement early on has led to really tragic inequities, that where we've had inequities, those have been widened and exacerbated by the pandemic response. I think more recently at ACOSS, we've had more active engagement with the vaccine task force, but that sort of came later down the track when some of the issues were more apparent. I mean, and today we're seeing the modelling come out from the Doherty Institute around particular groups and what is needed there in terms of vaccination levels. And it's really good to see that out, but it's a shame that that's come so late in the piece in terms of what the National Cabinet has commissioned the Doherty Institute to do.
And I might just add to Edwina's remarks. I would say two things. One, I think, first and foremost, it was an economic recovery response. It wasn't about trying to hit multiple policy goals. It was about an economic recovery, which is quite understandable. And so the voices who might have been at the table from the sorts of perspectives that we've been speaking about here just weren't considered, and that's not unusual. And I think what also was happening was health was seen as dealing with the public health response, including the vaccines. So there was a bifurcation, even more of a bifurcation happening in terms. So whilst you might have the economic and the health up there in the political and the public discourse, which is glass half full, fantastic, I do think there's this bifurcation, and my fear is it's the biomedical way of thinking about health. So health voices get brought in when it's questions about the vaccine or the vaccine rollout and so on, not about the sorts of discussions that we've been having today. But as Edwina said, I think where we saw the breaking down of the silos within government was around housing, and particularly we saw that down in Victoria, but it came in Victoria after the disgraceful behaviour the disgraceful situation in the flats. And so there was a whole political recognition that actually we can do this differently, or we need to do this differently. And it was then that there was also, we saw the Premier standing up and speaking about social inequities were reflected in housing inequities and how that also mattered for health. And that was fantastic. There you've got a Premier of the state joining the dots. So there were few and far in between, but I think it was the sort of the initial premise was it was an economic recovery, and health becomes the issue that's over here, talking about the public health response or the biomedical response. So all sorts of possibilities going forward for more inclusive governance around all of this. Miranda, I see your hands, and then Edwina, there's a question in the chat for you from Libby Salmon that we'll come to, but Miranda, you've got your hand up, and then Libby's question.
Okay, thanks very much for the report. I'm curious as to who else was in the classroom and what their reports were like. Did you also consider, different countries, or did you get a feeling for any that had done better and why, I suppose, in terms of using that opportunity to create sort of opportunities for ongoing systemic change?
So no, Miranda, we were only focused here in Australia. This was a huge amount of analysis across the 145 policies, but it's something that I would love us to do. I would love us to do this on a regular basis over time, so that we've got a constant sort of checking of policy responses and what it means for health equity, and widening it, particularly, I'd quite like to widen it across our region. But there's certainly our last report, or report from last year, there was a lot of interest in it internationally, and I'll be following up with those colleagues since, but no, I'm afraid I'm not afraid, we deliberately focused just in Australia.
Sharon, if you want me to take that question from the chat now, I mean, Libby, I think it's a really interesting question, and I'm not sure I've got the answer, but I take the question is about whether the perceptions of inequity are working against kind of collaboration or engagement from insurance and business sectors. And I think, I mean, not kind of specifically on those sectors, but I guess as a peak, peaks often have responsibility for progressing what they see as being in the interests of their sector, and they're, I'm not sure about whether the threats to the inequity at the level we've been talking about today, but I guess some of the strategies or the proposed priorities around reforming the taxation system to make that more equitable, sorry, will be ones where we don't necessarily always see eye to eye. But there's certainly been throughout the last year, I think the retailers in particular have come on very strongly in support of income support and the increase to income support, and particularly seeing both the benefit to equity as well as to the economy in doing so, and knowing that people with the least will spend money. So if you want to help the economy, you give money to the people with the least because they will go and spend it, as opposed to people on higher incomes who will save it. So if that's the economic stimulus is the aim, there's really good reason for that. I think in terms of the JobKeeper advocacy, we focus more specifically around job seeker and supplement to income support. What we saw last year was this JobKeeper supplement and JobKeeper were very tied, and so there was probably more joint advocacy and collaboration across that. But with the structure of the payment this year being the disaster payment, which was tied to employment, and initially people on income support were left out entirely, including those receiving income support who were also in paid employment, that kind of became more fragmented in terms of a collaborative approach to how that was dealt with. So I haven't entirely answered the question, Libby, but it's a good provocation. I will give it some more thought.
Libby, did you have something in mind with your question?
Thanks very much, Edwina and Sharon. I was actually almost thinking of the opposite. If you know the National Cabinet's response to the threat of COVID was astonishing in its speed and its reach, and then I was just wondering how the crisis of inequity plus climate change spurs on other actors, because it seems to me that any sort of government, doesn't matter what flavour it is, needs a lot of actors in the tent. Social justice doesn't seem to be sufficiently motivating for them. But if everyone's self-interest is really threatened by these things, do they make that extra effort to lobby politically, or where is that conversation happening? Thank you.
Yeah, I mean, I do think it's a great point, Libby, because I think there will be more and more people, well, more and more groups galvanised to action because of the so visible inequities in Australian society that have become so visible through COVID, and then of course absolutely with the climate crisis on top of that. I think the important thing, isn't it, going forward, which is where some of the campaigns I think that ACOSS do, is there's a kind of a lightning rod to organise around for other unusual bedfellows, perhaps, you know, get on board through those campaigns, because we know from historical analysis that successful social movements come when there's a strong cohesive voice in what is being asked for. A whole load of other things, of course, that are important, but that sort of cohesive voice. So when there are these developments with the campaigns with ACOSS and other colleagues, then perhaps that's the lightning rod to organise around. But yeah, I do think this is a moment, you know, it's when else have we had such an opportunity to organise in that way.
And we've seen through it sort of people like Chris Richardson from Deloitte Access Economics supporting the need for an increase to job seeker and saying, yes, it will benefit the economy, but the primary reason to do it is equity, and that is something we should be striving for as an equitable society. And that is the primary reason for us addressing this, as well as the economic reason, but not putting the economic reason front and centre. And that's, you know, coming from a leading economist.
Yeah, and I think that's very important, having that sort of, it gets legitimised by a more conservative voice, you know, it's not just the bleeding left as the usual, having that call from these other more conservative voices and organisations is important, and we absolutely see that at the global level. So yeah, more of that here. I'm not seeing Jensen.
Yeah, actually, I was just going to chime in on that last point. I mean, it does seem that inequality could be the glue that holds together quite different actors and for different reasons. So on the one hand, inequality is something we're substantively and ethically concerned about in its own right. Another way of thinking about it, obviously, is as a dampener on economic growth, which is a perspective that's gained currency. And then I guess what Libby is saying is that inequality could be framed as an amplifier of crisis, and that's why business groups and insurance groups, should be concerned about it in another way. So it seems that that recognizing those different consequences of inequality, could be what holds different groups together. So yeah, it's a very, very good point.
Great. Well, listen, we're at time. Thank you so much, everybody, for joining us for the discussion around the report. Thank you so much to Edwina for your remarks. Incredibly important work from ACOSS and colleagues. Really, I hope a rallying cry to join the coalitions of concerned around those and the consequences of inequality. A lovely way of framing it there, Jensen, to get us active. Please use the report for any purpose at all, but for advocacy, for information, for anything, any queries, please follow up with me or any of the other co-authors on it. So thank you so much for joining us, and the recording will be distributed if you want to listen to it all over again. Thank you. Bye now.
Thanks, everyone.